Mayor's office. We provided you with an opening statement earlier, so we will let you get right into your presentation.
Okay, great. Thank you so much, Lawrence, and committee members. I really am happy to be here. It's my pleasure. Thank you. Appreciate the opportunity and the opportunity to partner, hopefully partner in additional ways with 50 Forward. We're grateful for all that you've done for 50 Forward. We, as I hope you know, have a wonderful history in this community, 62 plus years of serving older adults in Metro Nashville. Really what we do when we say older, it's 50 plus. Used to not be old until I arrived at 50, and now it doesn't seem old, but we realize that there are individuals who are 50 who need support around caregiving, and when they have individuals, parents, family members who are over the age and need a little additional support, and that's really part of what we do and part of what we hope that you will help us support in new and different ways in this coming year. But really how we do that is, and what we do is to support, enhance, and champion really the lives of all individuals who are over the age of 50. And we do it through two separate ways. We have a variety of programs and services, but we separate them into what we call our lifelong learning centers. Used to be the old, quote, senior center, and that's not how seniors really want to call themselves. They don't see themselves going to a senior center. It's a lifelong learning center. And we have them spread out 5 different areas in Metro Nashville, 5 distinct communities. And to me, when we talk about community benefits, that is one of the benefits of these 5 lifelong learning centers. They really are reflective, beautifully reflective of those 5 distinct communities. But in those lifelong learning centers, we deliver programs and services, health and wellness programs, educational opportunities, social and opportunities for our individuals to reduce isolation. Older adults talk to us when we survey them about the 3 things that really are concerns and issues to them as they get older, and it is isolation, transportation, and financial concerns, really, as they relate to, frankly, to health care. So that's one area, and the main area that one of our main areas that we deliver programming on lifelong learning centers. And then the second is our supportive care programs. I think those are what most folks probably associate with us in many ways. That would be our adult day service program, our Meals on Wheels program, and we rebranded that recently. We call it 50 Forward Fresh. We have a wonderful partnership with the Nashville Food Project, and we discovered that we needed to be delivering food that was a little different and fresh, frankly. So we're calling it by a new name now, 50 Forward Fresh. Victory Over Crime and our conservatorship program fall under the supportive care. So that's how we deliver our programs in the supportive care end and in the lifelong learning centers. What we would love to do more is serve more, and that's what we hope we can do with our partnership with Metro. Last year we served over 20,000 adults, older adults in Metro. This year we need to serve more. We hope and know that we will serve more because the need is there. In the 2010 census, those numbers we really believe were low, but when those numbers came out, it was estimated that between 2010 and 2020 there would be a 33% increase in older adults or adults 60 plus. 33% increase right here in Metro Nashville. And just over the last couple of years, we have seen an increase in our programming that makes us believe those numbers really were a little low. Y'all know that the boom that has moved into Nashville just in the last couple of years, and it's not just, I think, the working individuals or the millennials. When they move in, their parents come to retire here, and other individuals, grandparents come, and they need supportive services. So we want to make sure that we can do that. We're working hard to make sure that we are working to find revenue-generating arms, not just the traditional fundraising. We're working with C&M, the Center for Nonprofit Management, right now, and their Innovation Catalyst. And we're also looking every chance we get to work on cutting expenses. But we really think that we are a wonderful partner with Metro government because of who we are and the individuals we serve. So I'm hoping that we can increase our ask, which is $300,000 this year. And we want to spread that equally across the 5 different lifelong learning centers and the 1 traditional supportive care program that is housed right now, sort of centrally located, that delivers our adult day service and our Meals on Wheels. That would be spread equally across those programs in hopes that we can serve more than we served last year, because we know the need is there. Okay, I think you asked specifically for us to talk a little bit about the impact of the work that we want to do. And so I want to talk to you for a second about the outcomes. Each of our lifelong learning centers has outcomes that they put together each year, really, that are beautifully reflective of their communities. You know, Bordeaux is a rich and traditional community, and it's different than Donaldson and the Wedgwood and Knowles community. But overall, they have very similar and overarching outcome. And in our lifelong learning centers, this next year, all of those centers want to increase the number of participants by at least 7%. I think that will be low, and I think many of the centers will increase more, but I'll use Bordeaux as an example. It is the smallest center physically, and so we struggle sometimes. We don't want to get in trouble with code, so we can only have so many in there at one time. The hope is that next year we will be able to announce something really fun, and we'll be able to expand what's happening over there physically. But right now, we're sort of limited with the number we can serve. But overall, we will increase the number we served by 7%, provide 1,000 hours, or 1,000 instructional day and evening classes. But truly, the goal of that is to make sure that results in an increase in quality of life and a decrease in isolation. That's really the overarching hope with our lifelong learning centers. Now move to the supportive care programs, which is really the second arm of what we do. Those who need support in a different way so that they can live longer, healthier lives at home. Those outcomes are, number one, that 90% of our clients will maintain or improve well-being, 90%. And 95% of our customers will develop a relationship with a 50-forward advocate. We say advocate, the majority of the time that would be a care manager. Sometimes it might not be, depending on the program. But a 50-forward advocate who will help them develop resources and a plan so that they can live a longer, healthier life at home. I know you also want to talk about, or wanted us to address, how we view and how we hope to create a more equitable Nashville. You know, to me, and the community benefits are so visible because of where our centers are, that we really do create such a wonderful community atmosphere. The centers invite folks to come participate. They're not just a community center for older adults. They really are a partnership with the community and are creating equity for the entire Bordeaux community or Madison community. Town halls happen there. Our council folk come in and have pancake breakfasts, and it really is such a wonderful opportunity for folks to be part of the community. We are excited to, in this next year, do something that we have not had an opportunity to do before, but create what we're calling a diversity and inclusion work group. I think we purposefully didn't call it a task force, but we wanted to call it a work group, and it was we just developed it. It's really so new that it's not even in the proposal, because we realized that while we as an agency, our staff and our board and all of our advisory councils were and are diverse, the diversity looked a little different and inclusion if you are in your 70s. We talked about isolation. As you isolate, if you do get isolated, you're less inclined to go somewhere that looks, if you don't have someone who looks like you, and you know this, but it gets worse as you age. And we were really struggling to figure that out at some of our lifelong learning centers. So we got the help of two wonderful students. I think they're master's level students, one from Belmont and one from Trevecca, and they really are going to help us figure this out, because we didn't want the Hispanic or Latina community, the gay and lesbian community. There are those in their 70s who are representative of those communities, but are struggling not only with the aging process, but with coming to a lifelong learning center and not seeing themselves represented. We really thought we were, but it just takes on a different meaning when you are an older adult. So we're excited about that and want to be more inclusive. I think we thought we were when we looked at who our staff and our advisory councils are and our board, but it was a little bit different for the population. So we're excited about that, in this group. Okay, that is what I have. We would love to partner because we've got more to serve and great things coming down the pipe. Any questions?
Do you, or don't you charge some type of fees for some participants to participate in your programming?
Yes, we do. Our
Okay.
lifelong learning centers, we do have a membership to participate in some of those programs, but we also have scholarships available. Nobody is turned away for those programs. Yes.
Is it fair to say your two buckets of work are you have the 5 centers, and at those centers there is like daily and afternoon programming?
Yes.
So elderly folks go to the center.
Yes.
And then the other piece is you do the services. Say there's Meals on Wheels and the conservatorship. Those are kind of the two
Yes.
pieces of work.
Yes, and you can access the supportive care services through the centers. It is not either or at all. And many folks find these programs through the lifelong learning centers.
Because you mentioned your population, can you follow up with some demographics on your
Sure.
clients?
Sure, I
That'd be
can.
helpful, thank you.
The $300,000 that you're asking for, you say you're gonna divide it up equally among the 5 programs and then the supportive care center?
Yes.
I mean, some of the places like to have more participants. I mean, what's the rationale?
I think because they all have about the same number, maybe not quite the same number of constituents in their areas. They just don't have the same number of staff necessarily. We've set Bordeaux as an example. We are working really hard to try to increase the number served. So we might have to look and be creative about how we're going to serve them, even though we physically can't put them in the building. But we know there are so many more older adults in the Bordeaux area. We're looking right now to partner with some folks over there to how to do that.
What's your annual operating budget?
Around a little less than $6 million.
I have a question since we have 30 seconds.
Oh, okay.
Who else in the city does what you do?
Nobody really, there, like the Council on Aging, and there are a couple of other folks who provide individual pieces. You might find some churches who deliver adult day service, but they wouldn't deliver lifelong learning centers. They wouldn't deliver, they wouldn't have the continuum of programs that we have. There are some, metro congregant meals, and we do deliver those, partner with those, but nobody really has the continuum of services that we have. And we do partner all over with other programs. If they have what we have, we really want to partner. We don't want to duplicate.
Thank you
Thank
very
you
much.
so
Thank you so much.
Thank y'all. Woo! I can talk very quickly for a Southerner, but I was trying to get it all in. So
You did it.
good, yay. Okay, so